All right, teachers, lessons learned from your friendly neighborhood healthcare worker. Number one, our employers wanted us to take a survey. They wanted us to do the survey so they could get numbers. So they could get numbers and tell the community how many people they had vaccinated, so that the community would feel safe and no longer live in fear. That's what they told us it was for. But really, they were collecting numbers to see how many people were vaccinated and to see how many of us they could live without. When they learned there was over 1,200 employees at Mercy that were not vaccinated and did not fill out the survey, they then turned it around and said, well, you need to fill out the survey. If you don't fill out the survey, we won't know what's going on. Most of the employees said, it's my healthcare information. It's my protected healthcare information. You don't need to know. Just like you don't need to know all the things that are going on in my body. It's my individual right to my healthcare information. So no one filled it out. 1,200 employees didn't fill out until the mandate came. And when the mandate came, they said, the only way you can work is if you get the vaccine or you start testing. And all of us were okay with testing because we wanted to protect our patients. So we tested. And then they said, no, the public health says you need to vaccinate or get an exemption. And well, the only way to get that exemption is to fill out the survey. And what did we do? Well, we thought our employer would do right by us by filling out the survey and getting our religious exemption or medical exemption. So we all filled out the survey. That was our first mistake. Do not fill out the survey. That is a way to get numbers and to divide your groups and to fracture you from within. Do not fill out the survey. So then, what did we do next? The next thing we did that was wrong is we started swabbing. Why did we swab? Again, it's because we wanted to protect our patients, because we didn't want to bring COVID into the hospital. So we swabbed. And we still continue to swab because we don't want to bring COVID to our patients. But what did that do? Everybody that swabbed, now they generated a number. And the number that was generated gave them the right information of how many employees they could learn to live without. Well, what happened? 800 people started swabbing every week. Oh, wait. Well, there was 1,200. Now there's 800. 800 people are swabbing. Look at that. Now there's 400 less of you. That's much better odds. We can't replace 1,200. We can't replace 800. But what are we going to do next? Everybody's swabbing. And now they're going to wait for their religious exemption. A lot of people got tired of swabbing and got the vaccine. A lot of people don't have a problem with getting a vaccine. They do have a problem with a mandated vaccine and someone telling them they have to have it, even though they had COVID before and have natural immunity, even though they're young and healthy and have been working with COVID patients for the last 16 to 18 months. They never had COVID, but it was their choice. They chose to get that vaccine. Other of us have had COVID and we recovered. We have antibodies. So, first mistake was filling out the survey. Second mistake was swabbing. So we went from 1,200 that they knew about after we filled out surveys to 800 with the swabbing, and then the numbers kept on going down. Now we're down to around 300 to 400 people that filled out religious and medical exemptions. Our employer said that they would do right by us. They would approve the exemptions. And most employers did. Most employers, all they wanted to do was get their people to work. But a lot of employers feel that they need to get to 100% vaccination, because even in New York, now they fired 1,700 employees at one hospital, and they say they're 100% vaccinated. Come to us. And so that's what your employers are going to do now. Some of your employers are going to say, we have a 100% vaccination rate of all staff members. Send your children to our school. and they're going to deny your religious exemption. And they're going to say, well, we sent all the religious exemptions to a third party. We sent them out. There's nothing we can do about it. The third party denied you. We can't do anything about it. There's no appeals process. So some of you got it and some of you didn't. So we went from 1,200 to 800 to 400. And now we're down to probably less than 200, maybe even 100 that got exemptions. There's rumors going around that possibly we will be training our replacements, because there's no longer 1,200 of us. There's no longer 800 of us. There is no longer 400 of us. Now there's 100. 100 of people, 100 to 300 people are going to be denied, and they're either going to get the shot to keep their employment, which is no longer their choice. They've been coerced into doing this because they need to provide for their family and their loved ones. But it wasn't their choice. They gave up their choice because they wanted to provide for their family. And there's nothing wrong with wanting to provide for your family. But when your work is twisting your arm and forcing you to take a vaccine, or you'll be fired and put on leave and forced to go without any pay, or burn through your paid time off until you have none, that is just wrong. And so that's what your employers are going to do to you. Your employers are going to whittle you down to where they're going to say, well, we got 100 or less people that have exemptions. They don't tell you how long that exemption is going to last and what they're going to do next. Well, in a certain amount of time, they'll bring in replacements for you. You'll have you train your replacement, and you'll be without a job. You'll just try to seek employment elsewhere, but all those other jobs will already be taken. So, what did we learn? Do not fill out the surveys. Do not swab. And do not fill out the religious exemption, because they're going to slowly whittle your numbers down to where you have no support. So what you need to do is say, no, we will not comply. We will not fill out the survey. Many organizations already did it. Walmart nationwide already did it. 50% of all employees did not fill out that survey. Walmart backed off. PG&E just sent out the survey to their employees. A high portion, thousands of their employees said, no, we're not filling it out. You don't need to know our personal health information. That's protected. You don't need to know. Guess what? PG&E just backed off. If you can, in your organizations, say, no, we will not do this. We will not comply. We are standing our ground. Then your employers will have no choice but to put the mandates away. Say, we cannot comply with the mandates. We have too many employees. We will go out of business. We won't be able to function. So that's what you need to do now. Say, no, we will not comply. Everybody, all over the state, no matter who your employer is, tell them we will not comply. We will not fill out the survey. We will not swab. We will not put in exemptions. We are here standing our ground. Your community is here for you. Your community will support you. Your community will house you, will feed you, we will clothe you, we will take care of you. So what am I asking everybody to do? On the 18th of October, all teachers need to stand their ground. We need to not show up to work. We need to have our children not go to school. And this might be a longer duration of time than we initially thought. One day is not going to cut it. One day is not going to help. We need a week. We might need 2 weeks. We might need 3 weeks. We are in it for the duration. And if you need help, we will help you. If you need to pay your bills, we will figure that out. We'll come by you, beside you, and help you. So, 1, do not fill out the survey. 2, do not swab. 3, do not turn in that religious exemption. Say, we will not comply. We will not do this. vaccinated or unvaccinated, we are standing together against the mandates. You will not vaccinate us against our will. You will not vaccinate our children against our will. We deserve the freedom of medical choice. So God bless you. God bless your families. We will see you on the 18th. This is a statewide protest against the mandates. We believe in the freedom to choose. Thanks, guys.